And it is an honor to be here. It's especially an honor to have so many new faces this year, including the face of Joy, our nurse practitioner, who made me just ecstatic when she showed up my office in Kissimmee a couple of months ago and said, Dr. Littell, I'm here to work for the conversion to a medical model for Life Choices Medical Center. We'd be the only one in Orlando that's going to be providing medical care, true women's health care, to women who show up in the moments of crisis where they will not make good decisions and they rely, I'm still emotional from that video, sorry. All right. They rely upon the judgment of healthcare practitioners, nurse practitioners, and doctors who truly believe and truly value and cherish the life within their womb and any future lives they may be blessed with. And that's our challenge here this evening, is to ensure that we make this, we're going to be meeting a lot of opposition, because anything that comes from God, anything that Christ wants us to do in this world comes with a whole lot of opposition. We all know that. So tonight in this room, we're going to say a great big yes to the move to a medical model. And I'm going to share with you for about 10 minutes from now some of the reasons why we need to do this. I'm a pro-life family doctor, and I'm proud to be that. And I could give you all the reasons why I am. Probably the best reasons, 3 of them are in this room, are 3 of my 5 children, Claire, Lael, and Thomas. And I have another daughter, Annie, who's right now in Harrisburg, PA, looking at a family medicine residency, and a daughter, Mary, who just got back from her honeymoon. And I have a beautiful wife, Kathleen. And obviously, we've been committed to life since we met, the moment we met. As a matter of fact, our first dinner conversation when we were both stationed in Fort Lewis, Washington, in Tacoma, was about how happy we were both to be members of the Catholic Church. And it was very exciting for me to meet a woman who was so committed to life. And that's my story. But you all have your own stories. I can say this much. As a physician, the one thing that always appealed to me about medicine is the Hippocratic tradition. You all heard about the Hippocratic Oath. And there's a couple of physicians in this room, and I could guarantee that none of the 3 of us probably took the Hippocratic Oath graduating from medical school, because in the 70s they kind of did away with it in most of them. But of course the oath to preserve and protect life, and most importantly the oath to observe and respect and obey the laws of nature, which are indeed the laws of God. And what I would argue is happening in healthcare in the last 50 years is we've seen a dereliction of duty on the part of physicians in this country. We've seen physicians following the culture instead of leading in the way we should have been leading all this time as true Hippocratic, natural law, God-fearing physicians. And I'm going to give you 3 examples of what we have failed in how we failed in our duties tonight. Number 1, I'll look at my 9-year-old, soon-to-be 9-year-old Thomas, 2 more weeks? Son. I just came back from a conference sponsored by Nemours, wonderful institution here in Orlando, and some of you might be here. It was over at Disney. And that's one thing I do. I go to as many conferences. Thank goodness I'm in Orlando. We can get to a lot of them, can't we? And this conference had, among other issues, the topic of the HPV vaccine, which I've spoken about in a lot of details in this book, which some of you will have an opportunity to get later this evening, The Hidden Truth. And I'm not an anti-vaccine person, but I get my feathers get a little ruffled, and the hairs go up on the back of my neck when physicians at a conference make statements like this. If parents do not follow your advice as a pediatrician, they are poison and there'll be trouble for your practice. Our duty is to protect children, which trumps parental rights. Those are 2 direct quotes. The next step in that conversation was, CDC says our duty as physicians is to protect every 9-year-old now, boy and girl, from the sexually transmitted disease of HPV, human papillomavirus. Now, you all may not know this, but cervical cancer, newsflash, is exclusively a sexually transmitted disease now. It used to be, but now it is. And so, for that matter, are these other ways that people are getting cancer, oral and anal rectal cancers, and I won't get into all the details how they're getting them, but you can figure it out. However, I've been at another conference where someone had the audacity to say, we need to vaccine my 9-year-old son, and if you don't, you're a bad parent, because we have no idea, and this was a quote, we don't know how they get oral cancer. Now, he was speaking to a group of healthcare professionals, from the health department up in Ocala when I first got there. And I stood right up and I said, I almost wanted to say a lot more than I should say as a Christian man, but I said, why aren't you just looking at the evidence? And the fact is that you have to have upwards of 6 partners engaging in a certain act to get oral cancer, according to the Journals of Infectious Disease, which I do read. Why don't you state the facts that monogamous and virginal people will not get these cancers? Why don't we educate young boys and girls about how to get these cancers? You know what the doctor said at the Nemours conference in Orlando last week? He said he was happy to announce this. Guys, we're moving towards a Category A recommendation for Gardasil vaccine in 9-year-olds. It's been 10. It's been 10 to whatever, 10 to 21, now 9. And he was so happy to state that because he said, and I quote, now we don't have to mention STDs, we only have to mention cancer to parents of 9-year-old kids. And if they don't get it, well, guess what? They're poison. Following the logic. And there's 300 pediatricians in that room, and not one has the nerve to stand up and say, you, ba. They don't, because you know what? Pediatricians are darn nice people. And I'm a nice person, except I'm sorry I don't sound like it now, but I try to be nice. But I'm tired of nice. We need truth. We need conviction, and we need courage. Now, I'm going to shift, and thank you. I'm going to shift to now the 15-year-olds. There's a conference I wish I could get to if I was not in solo practice in 2 places, and doctors, don't ask me how I do it, but I do for now anyway. Please send me a pro-life doctor to one of these places to help me. All right. But there's a conference coming up in Atlanta, the home of the CDC, Centers for Disease Control, and all the big shots in women's healthcare will be there. Anita Nelson, and who's the doctor from Jacksonville, who's such a big shot. Anyway, all the big names to write all the articles for all of us in our journals. And this is going to have all kinds of workshops on how to put IUDs in 13 and 14 and 15-year-old women, girls, excuse me. They'll call them women. I'm going to still call them girls. And the reason for this is the push, and we have 2 OBs in the room, they know this, the push towards something called LARCs. And I wish it was a LARC, L-A-R-K, but it's not, it's an L-A-R-C. Long-acting, quote-unquote, reversible contraception. Reversible to me means if I don't want to do it, I don't have to. But when you shove an IUD in someone who's 14 years of age and say just to keep it in there for 5 years and no one can take it out except the doctor, when you put an Explanton and Implanton in the arms of these 14 and 15-year-old and 16-year-old and 18-year-old, whatever women, and don't really explain to them the side effects, how it might cause depression, how it might cause weight gain, how it might cause heavy abnormal bleeding, and also lead to all kinds of issues, how it basically takes away their fertility, the woman whom they are, then I sure wish it was just a LARC and not an LARC. But the reason for all of this comes down, as I spoke in my book and wrote in my book, to an other overall overarching agenda in healthcare nowadays, which is prevent pregnancy at any cost. So if we have an opportunity, and I remember sitting in residency in Tacoma, Washington in 1988, having an argument with other residents, why are we pushing contraception on 16-year-old girls? And even then, the argument was because of all this stuff with it's happening nowadays, you hear the arguments all the time, we got to reduce carbon footprints. Even back then, they were having the conversations. We've got to stop humans from propagating. At the same conference I went to in Disney, they were talking about Zika virus, of all things, and the physician, who's right on faculty here at UCF, says, guys, it's time to spay and neuter humans, quote unquote. I always put quotes in my books, and I put quotes when I mean, this is the actual thing these people are saying. Another conference I went to in Orlando several years ago, the physician who came from Berkeley, who was the former head of the International Planned Parenthood Federation, put up a slide of Osama bin Laden. And the next slide said, large families breed violence. And there were 400 people in that room, and nobody had the courage, the conviction, the gumption to stand up and say, this is the American Society of Pediatric and Adolescent Gynecology, all right? And he was the Jane Fonda true professor, okay, of Berkeley. And that's her goal, is to get humans to stop propagating at any cost. So they come up with these clever names, and I know, the OBs in the room know them. We've got Skyla, we've got Liletta, we've got Morena, we've got Kylena. Now, if you're a parent of a 15-year-old, the doctor says, we have Kylena here for your daughter. Or they said, I'm going to put into your daughter a levonorgestrel-releasing intrauterine system, which will remain in place for 5 years. Would you take that as a parent for your 15-year-old? I'm thinking maybe not, but Kylena, that sounds great. Let's do Kylena, huh? This is what's happened. And listen, the minds and hearts of wonderful doctors have been corrupted at these kinds of meetings by these kinds of professors who write the kind of blankety-blank stuff that they write in our journals and get away with, because guess what? Our medical journals, 70% of the stuff in there is sponsored by Merck and Wyeth and all the pharmaceuticals. They own these guys, and they educate us. And all the doctors know that. The third thing I'll say before we move on is to talk about the abortion pill and what's happening to these children. The do-it-yourself-at-home abortion, I call it. What a bamboozle for the abortion industry. Okay, think about this. $500 for a chemical abortion where you just give a few pills to the patient, or maybe $500-600 for a surgical abortion, which is kind of messy. So you give them the pills. You give them misoprostol, you give them mifepristone, all these M&Ms. After they called it an M&M abortion when it first came out, by the way. It's a wonderful name, catchy name, M&M. Methotrexate, which is a drug used for rheumatoid arthritis. It stops DNA stuff from happening, stops cellular replication, so it stops the baby's DNA from reproducing itself in development. Or you can give RU486, mifepristone, which is an anti-progesterone drug. It interferes with the natural progesterone, the chemical that's trying to feed the baby. It's dilating the vessels in the placenta. It's trying to provide nourishment to the baby. You give those pills to the patient, and you say, go home and now take Cytotec or misoprostol, which we all use to deliver babies. I did that for 25 years off and on, to ripen the cervix and dilate the cervix and get uterine contractions so the baby will expel. So it's a do-it-yourself-at-home abortion. And there's clinics in this, I don't even call them clinics anymore. There's abortuaries in this town that are actually experimenting. Dr. Pendergrass was a great one experimenting. He's thankfully, we hope, going to be in jail someday. But he would tell his doctors, or his abortionists rather, they're not doctors, to just give everything. Give them mifepristone, RU486, give them the methotrexate, and give them the misoprostol all at the same time. I had a patient come in to me who had done all that. I couldn't help her. It's not even FDA approved. It's illegal, but no one in the state's investigating it. So if you know any state legislators, please, let's make that happen. But they're killing these babies left and right, and the abortion industry has seen it as a boondoggle, as a way to make a lot of money, and they are. Slowly but surely, the tide is shifting towards chemical abortion. The good news is there's something called an abortion pill reversal hotline, which comes out of San Diego, and I'm up in Ocala now, or I get these phone calls on weekends and weekdays from a person in San Diego say, Dr. Littell, we have a woman in Melbourne who just took the RU46 and she's gone home and she does not want to do herself at home. Can you help her? We do. By the grace of God, we do, because I was fortunate. When I came to Kissimmee and I was recruited by Dr. Hartman, who was here last year, the first thing he said to me, he said, John, go to Omaha, Nebraska, learn natural procreative technology from Dr. Hilgers, learn how to use progesterone. This is in 1997, or whatever, 98, whenever we got here, 98. And I am so thankful that I had that education, because now I can actually offer progesterone not only for women in crisis after they've changed their minds with chemical abortions, but even women, believe it or not, who are in danger of having miscarriages. My wife and I went through 4 of those, or 5. I mean, it was amazing. We didn't know about this stuff in time to use it, except for Thomas, who's here, and Layla, who's over there. So I'm pretty happy about progesterone, all right? And you should be happy about progesterone. And the fact that the OB community has not embraced progesterone with an incredible love and passion is amazing to me, because they're all about babies. So we need to convince and educate our OBs more about progesterone. So I'm going to conclude. I could talk about the stories, how we've been able to save the babies here at Life Choices that come in with the ultrasound images. And I have to shout out big time to those of you who are there in the battlefield doing those ultrasounds. Our ultrasound folks, if you're here, would you please stand up? Because those are the folks who were right there at the time that we need them. There's so many. Ginger, I know. and of course, Marianne Scotchy and the rest of them. And they'll call me and they'll say, Dr. Littell, you know, this lady might be having a miscarriage, might be having this. And that's where the medical director really comes in, you know, to help with these other decisions and to help them keep their babies and give them an OB doctor. I don't deliver the babies anymore. I'm in 2 towns. I'm more time on the turnpike than I would ever be in the delivery room. But I've done some good things on the turnpike, but that's another story. But the point is, they're there. And here's the thing I have learned. If you don't make the personal contact really quickly, real quick, with these women, you lose them. So these abortion pill reversal women that call me that are in Sarasota or Melbourne, if they don't come and see me within 24 hours, number one, that's what it takes often to give them the progesterone. But number two, you're just a voice on the phone. And there's nobody there in Sarasota I can refer them to that's a doctor. There's no one there. You know, we're looking for more doctors. We need the doctors to see them, to treat these babies. So here's think about. I want you all to think about as I conclude. We are on a journey together. We are going to become, in Orlando, Florida, the first true, and I'll say this for sure, Catholic medical model that'll save babies. And I have to emphasize the word Catholic, not because we welcome only Catholics, but Catholic in the true term of the word universal, Catholic in terms of some of the people that have been on this earth before us. People like St. Augustine, who said a long time ago, something that I put in my book about why I could even write the book I wrote and be the doctor I am, are the doctors in Augusta, Georgia, who told me a long time ago, John, you're not Catholic if you don't obey the teachings of your faith, your church. And they promised me, these 2 physicians, Dr. Morell, Dr. Monga, said, if you start just listening and obeying, the rest will come easy. Well, I'll tell you, what came easy after I obeyed was not my life. That's another story. My practice, the things that happened to me, and that's another long story for totally stopping doing some of the things I was doing. But what did happen was my eyes were opened, and I started hearing the women who were sitting in front of me for the first time. I really could hear what they were saying without even saying it. When they came in and they were on birth control, pills, shots, implants, IUDs, or any of these issues, I could see in their faces, I just felt the pain. I knew they weren't truly informed, and neither were they empowered to make decisions about their bodies. And this is such a strange irony that I would say here that I feel I'm the strongest, most radical, feminist doctor I've ever met. And I'm just saying that with all honesty, not because I'm listening to women. I do have to say I have a wonderful wife and 4 daughters, so I do listen to lots of women all the time. And they're tired of listening to me. I'm really proud they came tonight because the last thing they wanted to hear was me talk. But they're here. But that is what it takes, is listening with all our hearts. What do we say when we're with the patient? Often after our HPI or history present notice, I'll say, okay, let me listen to your heart. Those words have never meant more to me than they do now. It's time for all of us to listen to the hearts of our patients, of our clients, of the women in this country who are crying out for help, who are looking for physicians and leaders and ultrasound techs and life choices centers. And most importantly, we implore each of us, let's point the finger back at us, that we would start listening better to the unborn children, to their heartbeats, and to the future children of our nation. If we could just start obeying what the tenets of our faith is, I promise we'll start listening. It takes a lot of humility for doctors to start listening. That's just the 3rd thing. Understanding. Before you have understanding, you have to obey. But to obey requires a lot of humility. I'm working on that one. But if we can all get there, we're going to make this work. Thank you for letting me speak tonight. God bless you. Thanks. Have a great evening. Let's make something happen.